financial year review of the Ministry of Justice be noted. Those of that opinion will say aye. Contrary, no. The ayes have it. I understand the next financial review members wish to debate is the financial review of the Health Committee. So the question is that the report of the Health Committee on the 2011-12 financial review of the Ministry of Health be noted.
Thank you, Mr. Speaker.
Honourable Annette King.
Thank you, Mr. Chairman. The financial review 2011-12 made the claim that the health sector was well managed, and while some OECD countries were forced to cut government health spending, New Zealand had slowed expenditure growth without needing to reduce health services or cut to the numbers of clinical staff. That, Mr. Speaker, was what was written in the financial review. So let's examine those claims that were made in the financial review. It's not easy to get the information that I'd like to share with you because, unfortunately, we have a minister who has been very, very clever at keeping information very quiet. And I did receive a letter that I thought might put it into perspective. And this letter is from someone who works in the health system who wrote to me and said, "There is a climate of fear, bullying and intimidation from the Minister and the National Health Board personnel that is destructive and into micro detail and management." Followed up by a comment from the Association of Salaried Medical Specialists, who said recently that the Minister had in fact intimidated a doctor into not speaking. And so we do have this climate of fear that exists in the health system. But I think it's important that I read to you from this letter what this person said about our health system. Absolute focus on the Minister's health targets and counting numbers is unwinding much of the improvements that have been made previously. Most of the increase in elective services was a result of work done under the Labor government and was just starting to work. The health target comparisons by DHBs are so totally meaningless, they don't reflect anything to do with real care or quality of outcome. This will only get worse as financial pressures build in the last quarter of this financial year. Mr. Speaker, Mr. Chairman, that comes from somebody who works in the health system. So let's go over those things that were said in the financial review. That the health system is well managed. What did the committee itself say in its report to this House? It said this: "We are concerned about the Ministry's capacity for delivering projects and meeting output targets, as reflected in the 7.6% reduction in operating costs and the 21 projects delayed that occurred in 2011-12. We note that almost half of these delays were because of staff vacancies and redundancies." So is our system working well, and is it well managed? Well, if the way to manage it is to delay up to 21 projects because there are staff vacancies and redundancies, it doesn't seem to me to be a very good way to manage it at all. And then you have a look, and I know Dr. Hutchison will be interested in this. What are some of those 21 projects we were told about at the Select Committee that have been delayed? Well, when I looked at this list, an alarm bell went off for me, because unfortunately I was the Minister of Health in February 2000 who was required to present the report on the underreporting of cervical cancer from Gisborne, a ministerial inquiry that had been carried out because of failures in the cervical screening program. So one of my first duties as a new minister was to present a damning report on our cervical screening program in New Zealand, where New Zealand women had died. So what has been delayed in 2011-12, these projects, the National Cervical Screening Program monitoring data. Why was it delayed? Because there are vacancies not filled. the development of the review and the update of the policies and standards within the National Screening Program, the monitoring and improvement of the quality of ethnic data on the National Cervical Screening Program registered, the high-grade analysis report on women with high-grade lesions on the National Cervical Screening Program. That is an example of some of the 21 projects that have been delayed in the financial year that's under review. Delayed, all of those delayed because of vacancies, because they have to save money. Now, Dr. Hutchison, you will know that it is not acceptable to put on hold important monitoring and evaluation of a program like the cervical screening program. Have we not learnt from what we did in the past? And so when it comes to saying that the Ministry of Health and the health sector is well managed, it is not well managed. When those vital programs are delayed, Mr. Chairman, those vital programs, they are delayed because the vacancies have not been filled. Then let's look at no cuts to services. Well, that is blatantly untrue. Blatantly untrue, and anyone who lives in provincial New Zealand in particular will know that that is untrue. The Ministry are required to save $700 million over 5 years, covering the financial area that we are looking at. So I just want to give you one little example, Mr. Chairman, of a cut in health services. And it comes from a little place called Westport. And what's happened in Westport? They had no orthopaedic clinics at the Buller Hospital for the last 6 months. None. Why? Because there's nobody to send there. And did they tell the people that we had been cut? No, they did not. The people of Westport did not know their orthopaedic clinics had been cut. It was withheld from them, and they only found out when the Westport News, the little newspaper down there, looked to see what was happening. And I could give you many examples, and I'm sure Minister Goodhue knows quite a few of them, because quite a lot of them are actually in her area of responsibility, and she shakes her head. But I'm happy to share them with her at a later date. We also have, from this government, what I call smoke and mirrors. And let's have a look at the claim that we have more doctors in our health system. That's been claimed by the Prime Minister, and that has been claimed by Tony Ryle. Well, what does the salaried medical specialist say? Of course, they're scoffing at them. They're a union, I suppose. Well, of course, I suspect, Dr. Hutchison, you were once a member of that very good union. What they said was that this repeated claim by Minister Ryle that there are 800 senior doctors, the doctors erupted with disbelief and anger. This 800 has been completely discredited and disproven by using official DHB figures and government data. There is not an extra 800 doctors in our hospitals. That is absolutely wrong. It's, in fact, we have 373 over the 3-year period. The hospital specialist numbers have increased, but not fast enough to keep up with increasing demand. Furthermore, said the salaried medical specialist, in the 3-year period Mr. Key referred to, and Mr. Ryle has, the rate of hospital specialist increases fell by 25% from the 3 years immediately before this government took office. So there you have it, Mr. Chairman. The claim there are more doctors and they haven't cut the numbers of clinical staff. It is not to be believed. Then we also have the claims that they have reduced costs. Well, let's have a look at some of the costs they've reduced. Because when you look at them, you'll find they might have reduced costs in the ministry, but they have now extended costs into some new organisations. The Health Workforce New Zealand. How many people are employed there? The Health Quality Safety Commission, HBL, and so on. So when you start to look at the bodgy figures, okay, so they mightn't be in the ministry, but they have been moved into other areas. But let's take the minister's own office himself. his office. He's only got the same number that we had when we were there, 8 ministerial staff. When we were there, they were paid a total of $349,000 in salary. What are they paid now, 4 years on? $746,000 in salaries in the minister's own office. So all this talk about cutting costs doesn't apply to the people who work for him, but they certainly apply for those who work in the home care sector who have not seen increases in their salaries. So I have to say, when I look at what the ministry said about the health sector and what they claim were the things that were happening, when you examine them just a little more detail, you'll find based on smoke and mirrors and some bogus figures and fiddling and twiddling with those figures. And Mr. Speaker, you will hear much more about the health sector over the next year or so, because at least people know that we are prepared to stand up for them in places like Wairau and Blenheim and in Ashburton and other places where they face health cuts.
Speaker, it is an absolute pleasure